Cephalosporins. Cephalosporins are a large group of antibiotics derived from the mouse Acremonium, previously called Cephalosporium. Cephalosporins are bactericidal, kill bacteria, and works in a similar way to penicillin. They bind to and block the activity of enzymes responsible for making peptidoglycan, an important component of the bacterial cell wall. They are called broad-spectrum antibiotics because they are effective against a wide range of bacteria. Since the first cephalosporin was discovered in 1945, scientists have been improving the structure of cephalosporins to make them more effective against a wider range of bacteria. Each time the structure changes, a new generation of cephalosporins are made. So far, there are 5 generations of cephalosporin. 1. First generation cephalosporins. They are very effective against gram-positive bacteria, but they're only somewhat effective against gram-negative bacteria. Examples of first-generation cephalosporins include cephaglaxin, cephalosporin, cephalosporin. 2. Second-generation cephalosporins. They also target some types of gram-positive and gram-negative bacteria, but they're less effective against certain gram-positive bacteria than first-generation cephalosporins are. Examples of second-generation cephalosporins include cephalosporin, cephalosporin, cephalosporin. 3. Third-generation cephalosporins. They are effective against many gram-negative bacteria and bacteria that haven't responded to first or second-generation cephalosporins. A few examples of third-generation cephalosporins include cefixime, cetabutene, cephalosporin, cefdenier, ceftriaxone, ceftazidime. 4. Fourth-generation cephalosporins. They work against both gram-positive and gram-negative bacteria. They generally yield for more severe infections or for those with weakened immune system. Cephalosporin is the fourth-generation cephalosporins that can be administered intravenously or with an intramuscular injection. 5. Fifth-generation cephalosporins. You may hear fifth-generation cephalosporin referred to as advanced-generation cephalosporin. Ceftaroline is the fifth-generation cephalosporin available in the United States. is often used to treat infections, including MRSA infections that are resistant to other antibiotics. They can be taken orally or injected into a vein, intravenous injection, depending on the infection. The most common sign of an allergic reaction to cephalosporins is a skin rash. It's rare to be allergic to both penicillin and cephalosporins, but if you had a serious anaphylactic reaction to penicillin antibiotics in the past, you shouldn't take cephalosporin. In rare cases, cephalosporins may cause a serious allergic reaction known as anaphylaxis. Anaphylaxis can be life-threatening. Seek immediate medical treatment if you're taking a cephalosporin and experience symptoms of anaphylaxis. Cephalosporins are generally safe for most people, including those who are pregnant. In fact, some first-generation cephalosporins are commonly used to treat UTI in pregnant people. However, you shouldn't take cephalosporins if you're breastfeeding. If you have to take antibiotics, make sure to tell your doctor about all other medication you take, as well as any previous allergic reactions to antibiotics. Make sure you take the full course of antibiotics as prescribed by your doctor, even if you start to feel better before finishing them. Otherwise, you may not kill all of the bacteria, which can make them resistant to antibiotics. Thank you very much.